Hi there, it's April Lee with Hope, Faith, and Thriving. This video is going to be a little bit of everything. I am so sorry in advance. I want to speak about a few things. I'm going to share a few things and just kind of speak my mind because I haven't been on here in a little bit. I have a lot I wanted to do and touch on and do all these different topics, but I feel like if you're new to my channel, I owe you some content because it's been a little bit. You'll see me post things like in almost like clumps of videos, or you'll see me a lot and I'm talking a lot and then I like disappear for a little while, and it's just a combination of just things I'm having to do, or my responsibilities or work or whatever, and symptoms and just doctor's appointments and stuff. So number one, I've been thinking a lot, and I want to talk about like comparing ourselves. So there are so many people in the world, okay, and we all go through things at different levels and variations. Some are similar, some are more extreme than others, and we all have stuff. And personally, I have my situation and you have your situation, and we all have something. You've got people that have an amazing life and barely deal with anything, you know, anything I would call like extreme. There are people that do have really amazing lives where they don't deal with too much, and they'll tell you that. In general, like, I am very blessed. Like, I am so grateful, and I am very aware of how fortunate I am that I have a husband and 2 kids, and they are healthy, and they are amazing people, and they love me, and we are, you know, an amazing family unit and all of that. I am aware of that, and I am grateful, so grateful to God for that, and I pray every day that it stays that way. And you have people that, you know, every moment of the day all over the world are dealing with tragedies and crazy things, and or nothing, or something small or big or whatever. But I think about these things and I think like, oh, why am I even talking about the things I'm talking about? Why am I sharing whatever? But part of me is like, I should just stop this and just stop talking about whatever and just ignore it, or why share it because it's not that big a deal. But I'm not going to stop doing that. I'm going to share my situation because I believe that, and I hope that it's helping someone, and it's also a good way for me to like vent and get things off my chest too. But I do not sit around all day thinking about it and dwelling on it and living in it in my mind. Like, just, it's driving me crazy. Like, this is how I talk about or think about, but when I'm on here, I'm going to share. So I did want to share my latest doctor's appointment. I went to a follow-up with my primary care, basically to just like, I have to see him every 6 months for blood work and stuff, and just to kind of oversee things. And that visit turned out to be really something good for me that I needed to go and take care of, because he addressed a few things that I didn't even know that needed to be addressed, and a possibility of even like treating something that I didn't know could be treated. So about 3 years ago, I was diagnosed with fibromyalgia about, actually originally, it was just at random. I was at the hospital. I ended up having something called costochondritis. It was about like 10 or 11 years ago. I was laying in a hospital bed in the ER, and after nobody could find out what was wrong with me, they did like a manual exam, kind of pressing on my muscles and stuff on my chest and my ribs and all that. And the lady leaned over and said, have you ever been diagnosed with fibromyalgia? And I said, no, what the heck is that? And she explained to me what it was. And I thought, well, no. I took offense to it, and I thought, you're crazy. Because the way she described it, it sounded like I was making it up in my head, you know, like making myself feel this way. So I blew her off, and she diagnosed me with basically like, look into the fibro, whatever, you know, look into that. But you're definitely having costochondritis. So they gave me like medicine and like a injection and medicine take home and stuff to deal with that. And that was my first major pain thing, dealing with something like to an extreme, because it was really hard to breathe or like expand my lungs or whatever because of that. And I don't know where that came from. It could have been part of the fibro that I didn't know I had or whatever. But I was diagnosed officially in like I think it was 2021, after already having full blown fibro for a good year, finally getting the proper diagnosis. And so since then I've been treating it and all that, but I felt like I had like a handle on it, because you have those people that say, oh, I'm fully healed, or oh, I did this and I'm better and whatever, or I'm cured and all this stuff. Well, some people do get to a point where they do something or they do a bunch of things and they're basically like better or almost cured-ish, I call it, because it's always kind of there. And I think it depends on the severity of it, how long you had it, and why it's there, and whatever. And so anyway, I had a kind of like a grip on it, I would say. Like I was down to like 15 hours a week at work, and it completely changed my whole life. But I could at least like, it wasn't like every minute of the day and every thought on my mind, because I was able to control it better. So I got COVID, and I got better from COVID within like 2 or 3 weeks. And then I ended up getting what they call long COVID. Like it just kept going and going and going. And then every condition I've ever had been diagnosed with and didn't even know I had, came out really bad, and has been bad ever since. It's almost 3 years. And then I ended up developing something called mast cell activation syndrome. Shortly after that, within 6 months, all the signs and symptoms of that came. And then ever since then, I have been on this mission to like find the source and the cure and whatever. And finally, a few months ago, I came to terms with, if I never find the cause, am I okay with this? And I just had to say, well, what choice do I have? So I said, okay, I'm going to be okay with it. This is where it is. This is my baseline of living. Like physically, I've done everything possible. Like there's no, I know deep down, mentally and spiritually and like physically, that I could do, and I've tried to get better. I've done it all. And so I was finally like, all right, I did it. I've done it. There's nothing more except for just keep believing and keep, doing what I can. And one day maybe I'll get well. And so I went to my primary care and I explained all this to him, and I'm telling him my life, and he looked at me and he's like, talking about the long COVID, and he's like, I think what's going on is the fact that it's obvious that once you got COVID and you never really fully recovered, it reactivated all these things, and you've never gotten to a place where your body has like, gotten better, right? And you're just getting more things. So he's like, there are doctors, he doesn't know who they are, but he's like, there are doctors out there that are successfully, I don't know who they are, if you know any, please tell me, successfully treating long COVID, or what he documented on my paperwork as post-COVID syndrome, or whatever they want to call it. I feel like they have done so much research, and they're trying very rapidly to help people who have been suffering basically like the outcome of never fully improving from not fibromyalgia, from long COVID. And so I don't know if I'm going to find a doctor that does it, but I'm hopeful, because basically my symptoms, so I have fibro and all of that, but ever since I had long COVID, I never really recovered. It's like so many more symptoms and so many more problems. And it's not that fibro is worse, it's that I have all these other issues. And so the whole hope is that if I go to a doctor that can treat maybe the long COVID symptoms, I don't even know. We're going to find out. If I find someone, trust me, I will document and share whatever I can if there's improvement. But I think the goal would be to get with a doctor that can actually do something like that and find out what they do. I've seen something on the internet where I swear they have like all kinds of different like things that they've done, where they've done like one or two like I don't know if it's injections of something or something that they've done that is actually starting to improve the chronic fatigue portion of the long COVID. So when people got sick with COVID and then they never got better, and some of my clients even, they've come in, they're like, yeah, I have what's called long COVID, and they're describing all their symptoms. And they're literally describing fibromyalgia. So they're, like when I get up and I go to do things, like I get really tired really fast and then I start hurting all over. And obviously with fibromyalgia, you hurt already and you're already tired, but as you do things, it wears you out, and you have to lay down and rest and recover from just basic functions. Like, I don't know, cleaning your kitchen. You got to take a break and rest and recover as if you ran a marathon, pumped weights, and clean your entire house. That's kind of like what they're describing. And so long COVID to me is basically a combination of fibromyalgia and chronic fatigue syndrome. And then you're just saying you have long COVID. Like, it's like you almost have those two conditions mixed together, and that's what long COVID is. But, or this like COVID syndrome thing or whatever. But anyway, that doctor appointment turned out to be something good, and it kind of opened my eyes to maybe even though I'm giving up on like, or I'm not searching for a source, he's basically saying like, I think that is your source, honestly, is that once you had COVID, it reactivated everything, and now you just are chasing symptoms and you never feel better. You're always exhausted. Like, it's ridiculous. Like, I slept, I took melatonin. I slept, I think I fell asleep by like 11 to like 6:30, and I feel like I never slept. It is ridiculous. I even had a sleep study done. I do not have any form of a sleep issue except basic insomnia. So I take melatonin, it helps me get to sleep, but no matter what I do, I wake up, it is like I never slept, or maybe I slept like a few hours. And so I always have dark circles and I'm always exhausted and all of that. So another theory my doctor has, we're trying it out, is that because I have been mentally coping with so many situations with not my life, but with illness and how it's affected my life. Like, it's been almost 12 years since I've been like dealing with stuff, but 5 years, almost a solid 5 years since the beginning of full blown fibro and like all this other stuff. And then a solid 3 years of this long COVID stuff. He's like, I've been his patient for 20 years, I think. And he's like, you are not a depressed person, and you are not, he's like, this is not your norm. And he's like, you are coping mentally with so many physical challenges and so many things that it's just a lot. And he's like, I believe that you have a situational anxiety, depression, or whatever, over your situation, because it's a situation that you're not happy with, you can't leave it, and you're living in it. And I'm the kind of person that, when he told me that, I was like, at first I was like, what do you mean? Like, I am so happy. And like, and I know I don't sound happy now when I'm talking about this. Like, I'm not happy when it comes to my illness. I am, in general, like, I'm happy. Like, I'm happy with God. I'm happy with my children. I'm happy with my husband. I'm happy with my family. Like, I have a wonderful life, and I'm grateful and happy in that way. But I am so not happy when it comes to living the way I'm living. It, like, how do I put this? So the conditions I have, all I did was try to fight them, because mentally I was like, all right, if I fight this, then I'll be better and I'll get out of the situation. Well, I'm not out of the situation, and I am totally not happy with this situation. I hate it to the depths of my soul. I hate being sick. I do not like it. I do not love it. I do not like it. I do not want it. But because I I think what it is that I think he's seeing this too, is that I finally come to terms with like, if I can't get rid of it, and you know, I'm a fixer and I'm an encourager, and I'm like, I'm one of those people that like, I want to, you know, give me a problem, well, let me fix that for you, let's get you better, let's move on, let's improve that. Well, this is it right now. Like, there's a part of me, I'm like, I'm gonna get better and we're gonna get past this, whatever. Like, yeah, like, you know, God is definitely very present in my life. And this appointment alone, I'm kind of getting all over the place, but this appointment alone, I believe that the Lord is going to do a lot of things. So basically he said, I think you have, he's like, I know you have situational depression based on this situation you're in. And he's like, it's a lot, and it's been a very long time. And so I sought out therapy immediately, like, because what happens is I'm mentally, he's like, you're putting on a front, and he's explaining it to me. I'm like, what? Honestly, like, it's hard. I'm sure you guys on here can see, you're like, what the heck? You're probably like, so miserable lady. But the thing is, like, it's weird. It's like, I'm very happy. Like, I really am optimistic. I'm like genuinely, I'm a happy person, but because I'm in this situation, I'm so unhappy about this situation. I am not thrilled with it. And he's like, it's a situational, he's calling it a situational depression. That's what he documented. I was like, all right, well, you know, years ago, like, and I talk about this all the time about emotions and stuff. When I was younger, like, I would be you know, I would react to something and I'd be depressed about it, and then I'd fix the situation and I'd be fine. And I've learned over time, like, man, my phone is going crazy, that mood and how you feel doesn't have to control how you like respond, right? So I've been very aware mentally that all my life, after I got older and more mature, and like realized, like, not everything has to like be a crisis. So let's say you're having a bad day, like, it's not the end of the world. It's not every day all the time. But I think that the fact that what he's trying, and this just happened yesterday, so what he's trying to tell me is that your situation is difficult, and you're mentally putting on this front, and you're trying to be so tough and strong, and it is physically starting to affect you. So I have been getting extreme vertigo out of nowhere. I mean, out of nowhere. I get it even on vacation. So I went on a vacation, and it tried to like start coming on because I get migraines, so they don't know where the vertigos come from. You know, the neurologist thinks like, oh, it's related to your migraines, possibly your neck. And then like the spine doctor is like, oh, it's probably your neck. And then of course, like my primary care, he's probably thinking, he's not sure exactly, but I think because the appointment isn't very long, you know, he's trying to get to the point, get me better. So I think that, I mean, I'm not sure, but I'm thinking that he's thinking, after researching the medicine he wants to put me on, is that my body, because my mind has been coping so much in trying to like get through this physical transition of healthy to like totally like malfunctioned, that it's causing additional symptoms. So I had a few episodes. I had one episode years ago when all this started. I had fainted just once, and it came out of nowhere, and I just did, and go to the hospital, like, oh, it just happens at random. It's just whatever. We don't have an answer for you. Never happened again. But ever since then, I would have certain things that would happen that I would get, it called pre-syncope, where you basically like, you feel like you're about to faint, and then you can't see. Like, well, I couldn't see. So like the room would get darker. I would black out for like up to about 10 seconds. And then my vision comes back slowly. And then I'm good if I like kind of like brace myself. Now, this does happen sometimes when I'm working, and I'm gonna know based on starting this medication if it is my body freaking out causing those symptoms, because it doesn't happen all the time. It's like it comes in waves. Like it might happen And it's never when I'm sitting. It's always when I'm standing or like I move a certain way. And it's never when I'm like, I'm not stressing mentally. Sometimes I'm even like laughing, having a great time, and it's just suddenly there. Or I'm like putting like a dish in the cabinet and suddenly like I'm dizzy. And I swear it's a combination of like, I think it's positional of my neck because I think I'm getting nerve compression or something. That's what I think. A lot of my issues are from my neck and like my trigger points and muscles in the neck. They seem to trigger the migraines and stuff. So putting the injections back there and like doing all the treatments in the back of my neck seem to help me the most. And I have less vertigo and stuff. So I don't know. I'm just talking this out because if you deal with illness and you deal with the stuff I'm dealing with, I'm sharing this because I'm just sharing my theories and my ideas because a lot of us are similar. So I have another person on YouTube that I was watching them and she's like, yeah, when I press on the trigger point, like I get nauseous, and so do I. So like if I don't even want to do it, it'll make me sick. I have these two knots. I have one here and one here, and it's the trapezius muscle, and there's these trigger points there. And they're constantly like squeezing and really tight. And so I have shots back there to kind of calm and loosen the muscles. And even then, when they're still tight, if I lightly press, it triggers nausea. So it does make sense that if they're tight and I go to move my head a certain way at work, or like I do something, or I'm doing, dishes or something, that it can trigger nausea and then that vertigo sensation to come on. So usually, before I didn't know what the vertigo was. And so I would get full blown vertigo, room spinning, throwing up, sick, and then I'd have to backtrack. Now I sense it coming on and I'm like, it's either a migraine or vertigo. So I usually have on hand, and this isn't every day. This is like, sometimes it'll happen twice a month and then it won't happen for a little bit. And then it'll happen like 4 times in a month or once a month. It just depends. But it seems like I can't skip a month without having it. And so I have, my neurologist had me take Dramamine, but it's a 12-hour less drowsy Dramamine. And then if I get continuing nausea, then I'll just take a Zofran, which is, there's another name for that one, but it's a prescription anti-nausea medication that I was prescribed by the doctors, and it does help a lot. So it like stops me, and then I'll take a little Gatorade too for the electrolytes, but it stops me from getting full-blown vertigo, because when I do that, like I'm out for the day at least, and then I can't move, and I've got children, I've got a life to live. I can't be laying in bed with a room spinning. So at least I can control that. There's people who they can't even do that. So I can do that. But so the medicine that he wants me to be on, I did start it today. It's like a super, super low dose. It's like 2.5 milligrams. It's called lexapro. And lexapro is for, I'm not a doctor, but I just know a little bit. I know it can help anxiety. I know it can help depression. So the diagnosis right now is situational depression. The reason I'm sharing this, and this is like very like personal information, but I'm sharing this because I want to document, and I also want to show a lot of things. I want to show that you don't have to be ashamed of being in any situation you're in. You can feel free to share what you're feeling. My situation is not the worst in the world. It's not the best in the world. I had a doctor literally look at me, and after reading my stuff, and he's like, what brought you here? And I'm talking to him. He's like, oh my gosh, I would have jumped off a bridge by now. And I looked at him and I was like, is it that bad? Like, I have been living in this so long that I didn't even realize like how hard it really is, and how much I'm really trying, and like how life-changing it has been. But then I could look at someone else that just went through something very tragic or traumatic or died, and I'm like, well, this is nothing compared. So I want to say that it doesn't matter what extreme you're at. Let's not compare, because we need to feel free. Sorry about my dog. We need to feel, hey, shh. We need to feel free to be able to share and like express and talk about whatever we want to talk about, and not compare, because if we compare, we'll never share. If we compare, I'm a jerk compared to what so-and-so is going through. And trust me, like as I talk and share, it's not that I'm sharing like this is the worst ever, because honestly, like this could be so much worse. I mean, so many things I could think of that I don't even want to say. because, hold on, sorry, because I don't want someone else, like if I say, oh, my situation's not that big a deal and their situation's not even as bad as mine, they're like, well, is mine not something? Because honestly, like if you feel like you're dealing with something, you're dealing with something. I don't care if it's big or small or whatever to you or to me or whatever. It doesn't matter. You're the one dealing with it. There are people that have one of my conditions that are not coping well at all. There are people that may have, I don't know them, but may have way more than I'm dealing with and coping amazingly well. Does that mean that I'm a jerk or I'm weak and pathetic? No. Does that mean that they're like, you know, on top of the world? No. Because when I went to the doctor and he told me that, I was like, I'm so strong and I'm so this, and if you know, anyone else in my situation, da 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 da. And he's like, April, you are putting on this huge front and you're being so strong and it is not healthy. It's not healthy. He's like, I want to help you. Just, you know, think about it. And I left the office and I was like, what the heck? But I've known this doctor a while, like a long while. He's known me in my 20s, in my 30s, and now in my 40s. And I trust him. And I got in the car and I thought about it and I was just thinking about the Lord and like what came of that appointment. So there is something that I really, really, really need in order to be able to eventually stop working and take care of myself. And I'm in the process of trying to have that happen. And I've been denied many times. And by going to this appointment, I didn't even realize what was going to come of this. And it was something that very beneficial to me, and explaining my situation and documenting and showing like the reality of what these conditions have done to my life, and how they've altered my ability to do things. Like I used to work, if my clients know, like they've seen me, like I had I had 2 clients at a time, and I balanced that very well. Everybody had their attention. I did one to the next, and then I would go, you know, 3-4 days a week, like nonstop clients, like many clients. Okay. And I would clean in between, and I would, you know, make sure everyone's happy, running around, zippity, right? And now it went from that to, over these years, I'm down to basically like total of 10 hours a week of working. I have like, after 1 hour of work, I'm already having issues and symptoms that I have to deal and cope with. And then I am starting to like wear out and everything. And by the time I get to like the third person, my body is shutting down, and I can push through a little bit longer, but like before I was pushing through even more. And by the end of the day, like I couldn't even like think straight. I was like physically distraught, mentally like like trembling. Like I would leave work, I'd sit in the car and I'm like bright red, starting to run a fever completely. My body is like in shock, which sounds so weird, but it's just the fact that I'm physically like pushing through, that my body after a while is like, oh my God, it's trying to cope with what I just did. And I mean, my job is physical, but I'm not like running a marathon. But it's an extreme. So I went from one extreme to the next. And so my life cycle is, when I do work, even if I work a couple of hours, like I get through it by like completely changing everything that I've done. And there's times now where my hands are cramping while I'm working, and I have to like, you know, I got the cart, I put the comb down, I'm just kind of like massaging my hand and like trying to get through it, or my hand goes numb, I'm dropping things. I'm getting like vertigo and the nausea coming on, and they don't know if it's from the neck position or it's from possibly my mental state. I'm coping so well, and then I'm at work and I'm in this environment where I'm having to push through physically through all the symptoms that you can't see, but I'm pushing through them. And it's possible, and I guess I'm going to find out with this medication, it's possible that the extra symptoms of the vertigo and the presyncope and stuff are coming on at random because my body is under so much stress in just surviving. So I'm like in this survival mode because I have chronic inflammation. I've got these conditions. My body is just not functioning right. And so I'm like, I got this. I'm cool. I'm good. You know, I'm at work. I'm like laughing and joking, and I'm like, you know, talking to my client, and I'm trying to be like, in the moment of that and ignoring. It's like ignoring that your house is on fire and now you're not gonna like take the fire extinguisher and put it out. You're gonna like go plant roses out front, and then you come back later and now the whole house burnt down. So I know that sounds weird, but that is like what happens to me. So I'm doing my job and I'm starting to react to the chemicals around me. My face might start turning red. I run low grade fever. I'm like having crazy symptoms. Sometimes I'm starting to get pain or numbness. As long as I don't like black out, I'll stand there. It's just the way I am. Like I just push through, but it's starting to like really affect my physical state more and more and more. And I'm working less and less and less. And mentally it's becoming, I think what's happened is that I've like, I can do this. It's like, you can only like positively push through so long that it's not that, my mind can't keep pushing through. It's that I am not physically doing as well as my mind is trying to tell my body. And my body's like, girl, yeah, no, I'm gonna black out now. I'm gonna throw you some nausea. I'm gonna do this, I'm gonna do that. Like, it's crazy. And so the situation that I'm in is hard. So I even if I don't go to work, but let's say I go to work and then I literally come home and I'm like, the computer has shut down. And then it takes me like a minimum of 48 hours and up to 5 days to like get back to something normal of what I was, and the cycle starts again. So, I mean, who would love that situation? I love what I do and I love my clients and I need to work financially. And I'm good at what I do and it is good for me mentally, but at the same time, it's like this battle of like, it's like trying to run without legs. Like, it's impossible, but because I can like, my body's still, like I can still walk and stuff and I can still have my hands and all this, like I tell my mind to do these. I'm like, I'm good, I'm gonna do this, but eventually, and it happens at work and it happens in general, like my body stops working. So I was at work, I had a new client coming in, I had crazy symptoms, I'm doing her hair, I'm literally, before she came in, I had it's presyncope where you literally can't see. So like 10 seconds of that and I was starting to get like lightheaded and dizzy. So I do all my stuff and I'm like, all right, I can do this. I'm doing her hair. I am on the verge of puking. I am so sick feeling. And so I'm like, let me see if I have thank God, I had a thing on my purse, Dramamine, less drowsy Dramamine. So I took that and drank some water and like I'm standing there and I'm having to like pretend with all my might that I'm good. And I go to the back and I'm laying down and I got a cold thing on my head and I'm praying. I'm like, Lord, please, I've got to get through this lady's hair. Like there's only one other person working in this whole building. And so this is the kind of stuff I'm dealing with. And I go out and after a little bit and I check on her hair again and I go back and I like get through this and I get through it and I'm like, I'm good, I'm fine. I'm trying to ignore it. And the medicine's helping a little, but is not enough. And I'm starting to feel really sick. So I finish her hair. I have a 30-minute drive to get home. And in my mind, I'm like, all right, I got to strategize. I'm like, okay, I really don't want to pull over and get sick because, and I don't want to ruin my car. I don't want to get sick in my car. So I'm gonna like, okay, I just got to like do my breathing exercises, stay calm and chill. And I'm like, Lord, please, God, just get me home without throwing up. So I had texted my husband. I'm like, please see if I have Zofran left. He had it slapped out on the counter for me. I run home. First thing I do is take the Zofran, get an ice pack and sit down and start breathing through it. So this is the kind of coping that someone like myself, I'm just painting a picture here, is dealing with. So all I did was just go to work, try to make a living, do what I always did, and my body's like, nah, nope, not happening today. Now, it's gonna get to a point where no matter what I'm telling my body, yeah, you're going to do it, eventually I may pass out in the salon. So I have to figure out a way to not do that. And this whole telling myself I can do it, I can do it, I can do it is only going to go so far. So fortunately, thank God, after the Zofran, within like an hour, I was a little better, but then I was physically unwell and extremely fatigued for 4 full days after that, over just going in for 3 hours of work for one day. It's insane. And so mentally trying to even grasp that is like insane. And the fact that I can't just be like, all right, I got to go home and take care of myself. Like, I need to work and provide. So I'm there doing that, but my body is like fighting me. So mentally, what I'm hoping is the fact that I'm mentally trying to cope so hard and my body's like starting to physically like cause these other things to happen in addition to all my other symptoms and making it worse. I'm really praying that this medicine helps my mind calm down a little bit, so that way I can get through my job a little bit better, hopefully, because it's the physical work and pushing through the symptoms is what is like making my body start to like panic and shut down, because I'm not mentally, I'm like, all I'm worried about is like, I don't want to be sick. I got to deal with this person. I want to take care of them. I want to provide this service, but yet I'm not feeling good. It's not like I can just walk away from like my computer or whatever, or excuse me, a moment, like in a hair salon setting, like it's difficult, and I'm in my own private room. It doesn't matter. But anyway, I got through that, but this is becoming more frequent and it's becoming very difficult. And so personally, I'm really praying that, even though I'm powering through mentally, it's like you can only tell yourself so much. Like, I am positive about it, and trust me, I go to work, but my body is it's going to do what it's going to do. Like, it doesn't matter how positive I am, but we're going to find out if this medicine is going to help with those extra symptoms that are making it even more challenging to do the even tiny bit of hours that I'm doing. So I'm going to document that, and I'm sharing this because I want to see. I'm curious, and I'm hopeful, very hopeful. I know this video is getting a little bit long, so if you are watching it, I encourage you to like go through sections and find what you want to hear, or just maybe listen to it in sections, because this was not planned out, and I'm sorry it's getting long. But okay, so off of that topic, in general, if you feel like you are like, there's so many things I could feel. I'd be like, oh, I'm weak and pathetic, and I'm not fighting strong enough mentally or coping well enough. Like, I need medication. I'm not looking at it like that. I'm looking at it like this. I'm a strong person. God has made me a fighter. God has made me an encourager. God has made me so strong. And I've dealt with so many challenges that affect the mind when I was younger and in my teens and 20s and all that. And I have powered through. And if anyone can deal with something mentally and really push and power through that, it would be me. Like, I know I can do it, but I'm like, you know what? I will take the help, because it is so exhausting constantly like, it's okay, I'll be fine, like it's not easy to do that, and it takes a lot of energy to do that. And I'm curious to see if, even though I'm positive and even though I'm pushing through, if this will just kind of like calm my body, because I'm trying to cope so hard mentally with the physical that it's like making everything worse, if that makes any sense. So if I could not have to fight it so hard, maybe physically I will feel it's not going to cure me. Even the doctor's like, it's not going to take all your symptoms away, but maybe, you know, maybe it will help you. It'll help you cope better, and then help you also to maybe have like less of those extra symptoms or severity of those. So we're going to see. Anyway, I don't know even what I started with in this video. I'm talking about so many things, but I just want to say that if you are dealing with something, it's your something to deal with, and just don't compare yourself. And if you need medicine to cope with something, you're not weak, and you know, it's not that you don't have enough faith or anything like that. Like, some people just need some help, and I'm willing to take it because this is difficult for me. It's hard. It's like endless. It's not going anywhere right now, and it's very difficult. And even when I can stop working and like actually focus on trying to improve, it's still going to be hard. I still have it, you know, it's still there, but I'm very hopeful. And I want to document if I can find a doctor that can treat the long COVID or the post-viral COVID syndrome, whatever you want to call that. Because that alone, like the endless cycle of the mast cells, so the overabundance of the mast cells activating and causing all these other things, it causes extreme fatigue and extra exhaustion and sleep interruption, and like it literally mimics fibro, but it's like it's different. It's like an addition to it, and it's exhausting because it triggers so many chemical releases in the body that it's like a endless symptom cycle, and it doesn't matter what I've done everything in the world, and I'm still dealing with it. So my body is so tired of fighting, and it's constantly battling symptoms, and it's I can't imagine like what my body is going through. Like, it should function normal, and then it's like throwing in like a computer throwing in a virus. It's like now all the things that were doing their things are like trying to like, now what do I do? So it's like my body's learning how to do everything in a different way, and sometimes it doesn't want to work. So I'll get a migraine or nausea or weakness or can't see or whatever. It's like ridiculous, and I'm tired. So yeah, I'm gonna document all this and share. If anyone has any questions or wants to hear an update on the lexapro, like how it's going to help me or not help me, or whatever it's gonna do for me, let me know. I am gonna document it, but if you have any questions, I'll answer whatever. I'm not a doctor, I'm just a person dealing with illness and sharing their journey. So if you have any other questions or whatever, just put them in the comments section. Please click and like and share and subscribe and all that stuff, because that'll get it out to more people. And know that you're not alone, and your situation matters, whether you have one thing or 50 or worse, better, or the same as me. So God bless you, and hope you're doing all right. Bye.